Okay, yeah, because with the audio on, you can't talk about certain procedures that might be considered controversial. No. Freedom of speech is still in the Constitution. We just don't follow it. Don't ask questions like that. There's some people in the front row that think they're going to change it through the election process.
Working on it.
I know. You're doing a good job, hon. You keep at me and we'll get it working. You are. God bless you. I still think the Constitution, which was designed to keep the government in check, is still a good document. Yep. Yeah, we're going to get it back. I like it. They might even put some health freedom in there, too, and not protect the freedom of the press. We're going to give the responsibility of the press. Yeah, so if they don't hold up their end of the bargain and they're bought and sold by a big industry, they're going to take their rights back. Okay, they don't get a chance to, well, they can still propagandize, but it's not going to be called news. Yeah, so that kind of stuff we can't talk about. Just because right now, if you're on YouTube or Facebook, you're watching a blank screen, and we start in about 1 minute. Whatever Joe says. He's a power-crazed little Brazilian guy. And buddy, thanks. Were you responsible for bringing the guy to film the celebration of life for my brother-in-law?
Wasn't me.
Oh, he did a hell of a job, though. It was so friggin' cool. Yeah, he got the spirit of the moment. It was just one of the most beautiful send-offs. We're going. Welcome to True Health Tuesday, and the truth will set you free. Arthritis, cause and cure, and and you could look at it as a complete abject failure of the medical system, but let's not get into that right now. Let's just look at arthritis. Now, there's some of the things that we can talk about, some we can't talk about, because of there is this significant censorship. We've been demonetized, we've been shadow banned. And so if you are watching this on YouTube and Facebook, YouTube, click the bell notice, because a lot of people are saying, oh my God, I didn't know you're still putting these out. Yeah, we put one out every week at least. Actually, we're about 3 a week. So I film up here and film it down in Mexico. And those of you that are supporting Dr. BVIP, God bless you. Thank you, thank you. And this will be uninterrupted on the Dr. BVIP, because there is some very sensitive subject that the government wants to filter before it gets to you. I don't think that's appropriate. I think that people should be able to come up with their ideas on their own, and that we should have freedom of information and freedom of speech. But the apprenticeship program, I'm going to try and get it next week, because the last week of this month I'm giving a conference up in North Carolina. So that's going to be fun. And Extreme Health Academy, you can still get on here for Bergman 14 is the code. You can get in there for 2 weeks for no charge. Now, so throw away everything you've thought about science being settled. The father of evidence-based medicine, Dr. David Sackett, and famous quote, medical school orientation. Half of what you'll learn in medical school will be shown to be either dead wrong or out of date within 5 years of your graduation. The trouble is, no one can tell you which half. So the most important thing to learn is how to learn on your own. Wow, does that sound like science is always evolving? It kind of does, doesn't it? Yeah, and we've got a new doc on staff, and he asked, what do you talk about to a patient who's taking multiple medications? Okay, guess what I did? And this is the meanest thing you can do to a young doc. Okay, go to this site called rxlist.com, look up each medication, and write down the effects of it. No, they're not side effects. The effects of it, okay? It's like cholesterol-lowering drugs have the effect of hardening the arteries, causing heart failure, and it has a side effect of maybe lowering cholesterol. Whether that's a good thing or not, it kind of depends on if your brain is 50% cholesterol and if you utilize cholesterol to build hormones. So that might not be a good thing long term. So he looked up the 19 different medications, and a lot of them have a lot of different effects in the body. Does anyone here know what 19 drugs do when you're taking it all in one body? Neither does he. So no one does. Yeah, it's kind of like a crapshoot. You know, have 19 dice and roll it and see what comes up. Yeah, it's going to be hard to predict. So half of what you'll learn in medical school will be shown to be dead wrong or out of date. Does that mean we're always evolving science? Like if anybody knows anything about physics, is that a done science? Math, is that a done science? Engineering, we already built everything you could build? No, it's called evolving. So we're going to get into arthritis. Now this is kind of tough because the second book I wrote was how to reverse arthritis. And a professional organization actually called me up and they says, how can you say you could reverse arthritis? I said, well, let's look at this. Okay, the most common type of arthritis, arth means joint, itis means inflammation. So when I say arthritis, I'm saying joint inflammation in Latin to impress you. No, seriously, all the medical stuff is in Latin still, so that it's kind of like a secret organization. So if I say joint inflammation and I say osteoarthritis, osteoarthritis, though, is a non-inflammatory joint inflammation. Now, anyone in here smoking enough weed to have that make sense? Okay. Okay, no. So really, so they made a mistake years ago. So osteoarthritis is a non-inflammatory joint condition, but it's in the joint inflammatory category. Now, and this is official, it's typically not symmetrical. It's going to be on one side. It's one joint, one hand, one foot, one elbow, things like that. And it's from a trauma. Now, rheumatoid or the rheumatic diseases, the theory is that the body is attacking itself. The theory is that it's bilateral or symmetrical. So if you got one wrist messed up, you got the other one messed up, okay? The diseases in that category, rheumatoid, scleroderma, lupus, psoriatic, polymyositis. And when I say polymyositis, you might think that sounds really bad. Poly means many, myo means muscle, itis means inflammation. So I just said many muscle inflammation in Latin to impress the shit out of you. Okay, so I get complaints all the time. You know, God, it's like 45 minutes. I got to wait all to the end to get the solutions. Okay, I'm going to tell you the solutions right now. Okay? And then I'm going to tell you the details of solutions. Osteoarthritis, it's from a trauma. That means that you had something normal and there was an accident. Okay? So would that be a biomechanical problem? Yes or yes?
Yes.
Okay, so number one, you got to fix the biomechanics. I know, a guy in the back just went, wow, brilliant. Okay, yeah, because imagine if you had osteoarthritis and you're not going to fix the mechanical distortion that was caused by the trauma. Does that sound stupid or stupid? Okay, so correct the biomechanics. But now let's say that you had a knee issue. Okay, your entire body weight's going to lean away from that to put more pressure on the other leg. Is that going to change how you walk? Is that going to change how the pelvis is? Is that going to change the biomechanics of the foot? Of course. So it's kind of foolish to have somebody with a knee issue and then they go to a physical therapist or somebody and the doctor writes a prescription to heal what? The knee. And you're not going to look at the overall structure because through writing reflex, if your weight is shifted off here, then this is going to shift, this is going to shift to get the pressure off of this. So this is going to be huge. Somebody just spilled water on the carpet, don't worry about it. You only cry over spilled milk. Okay, so you can't look at just a hurt knee. That's foolishness. You got to look at biomechanics. Then you got to get your blood healthy because you're going to see every joint in your body is two bones coming together surrounded by a joint capsule, and so it's filled with fluid. So every joint you have is hydraulic. And that hydraulic, that fluid in there is clear, it's beautiful, it's a little thick, okay? It's kind of like WD-40, but it's a filtrate of blood. So if the blood's not healthy, if their blood has increased viscosity or it's not holding oxygen, it's not going to get into that. This is why certain diseases such as diabetes, chronic stress, certain medical procedures that can cause a thickening or a problem with blood, such as blood clotting. Again, we can't talk about some of that, but you may have heard it. Okay, that can't get into the joints either. Okay, so then the joints, which are supposed to be hydraulic, can desiccate up. So supplements, getting healthy blood is super important. Reduce and eliminate toxins, that makes sense because your body is always regenerating. Okay, if you look at your system, every red blood cell in your body is brand new every 120 days. Your skin's brand new every 120 days. And you're always regenerating tissue, so you're a tissue producing machine. Now, if you have a significant amount of toxic environmental exposure, your body is going to be trying to detox from that, and you can only be in two stages. You can be in a stress state, or you can be in a regeneration state. Okay, does that make sense? You have an automatic nervous system, one fight or flight, one regenerative. Okay, so if you have significant amount of toxins, that's a chemically stressed state. And then deal effectively with physical, chemical, and emotional stressors. That's literally the solution. You correct the biomechanics, you restore the blood supply and nerve supply, deal effectively with the physical, chemical, emotional stress, and your body can regenerate the tissue. Now, if it's totally fused, if you've had medical intervention like cortisone shots, which destroy the joint cartilage, it's doubtful if that can regenerate. And honestly, that's the worst report of findings that I can give to someone. When they come in and I'll see one hand injected and it's just destroyed, one area not injected and it is okay, and I'll say, well, I can fix that one, but we can't fix that one. That's a sad case. Now, rheumatoid arthritis, and this is the rheumatic diseases, scleroderma, lupus, psoriatic arthritis, polymyositis, and dermatomyositis. What do you have to do to this? Now remember, this is supposed to be an autoimmune condition affecting both sides. How often do I see it symmetrical? Guess what? Never. Never. Okay, and I've been doing this almost 30 years. Never. Okay? Now, but you got to correct the biomechanics because you got to figure if you have a joint that's not working correctly, okay, that there's something wrong. There's not good blood flow. There's not good nerve supply to it. So you got to correct the biomechanics. You got to heal the gut. Why? Because the gut's 80% of the immune system. The gut is literally how your body regenerates. Healing the gut is huge. When we talk about digestive disorders, we talk about digestive disorders and neurotransmitter production, so anxiety and stress. We talk about digestive disorders and regenerative capabilities of the body. And you figure, like when we talk about digestion, you've got one nerve that does that to rule them all. It's called the vagus nerve. This does peristalsis, it does excretion, it does absorption, it does everything. Functions the portal vein system, so everything goes into the liver. I mean, this is amazing. That's 10% of what it does. 90% of that nerve is sensory. So and again, when Dr. Sackett was talking about how half of what every medical doctor learns in school is going to be proven to be wrong in 5 years, okay, why? Why is that nerve so involved in sensory input from the gut? Because your gut is how you live. This is everything that you take in. You got to break that down to amino acids from the proteins, fatty acids from the fats, and usable sugars from the carbohydrates. This is why you are a tissue producing machine. If you have physical, chemical, and emotional stress, your tissue production is down. If you're in a chronic stress state, your tissue production is down. So this is why when we talk about healing the gut, when you have a tissue production problem, that's what an autoimmune condition is. It's nothing some weird that your body is breaking down itself and attacking itself. That's foolishness. These are wizards who don't understand anatomy and physiology, and they'll say, it's hereditary. 500 years of God's will. No, God built you, okay? You're divine. You're made in the image and likeness of God. That's cool. So how do you correct the rheumatic? Correct the biomechanics, heal the gut. Make sense? Okay, then you got to get your blood healthy. Stress, physical, chemical, emotional stress thickens up the blood. If we just put scary images up here, okay, emotional stress will thicken the blood. That means it cannot get into the joints. Every joint you have is hydraulic. Okay, so we're talking emotional and chemical and physical stressors will do that. Then you got to eliminate toxins. Okay, why? Because toxins is a chemical stressor. You got two things. You got tissue production or stress. And deal effectively with the stressors. And if there's Italians in the room, no, this is too permanent, okay? Okay, dealing with the stressors means physical stress, you correct the physical problem. I worked with Italians for years. I grew up with them. That's not offensive. They go, yeah, dude, I know that man. Okay, so you look at this. You've got to deal with the physical, chemical, emotional stressors because those keep you in that stress state. You got two buttons. You got one that keeps you in stress, one that regenerates tissue. Does that make sense? Okay, now we're going to get into the details. Interesting. 2014, the role of Western diet in inflammatory and autoimmune diseases. Developed societies. Now, I'm sorry to use this term in 2022, because obviously when you're looking at the Western societies, the world in America, you think there is no way this is developed. I mean, you know, you had people running around with face diapers for 2 years. Okay, yeah. Okay, just assume that back in 2014 they didn't know how stupid this was, okay? But so developed societies, and again, that's a big assumption that we are, but they're meaning that, although have successfully reduced the burden of infectious diseases. What does that mean? That's called refrigeration, sanitation, and a road system. Okay, it's called clean water. That reduced the infectious disease. It wasn't face diapers, okay? Constitute an environment where metabolic, cardiovascular, and autoimmune diseases thrive. Now, why would that? Why would these diseases thrive? Well, because a lot of the chemicals that we're using to grow food, to create plastics and things like that are called endocrine disruptors, and they're damaging our system. Plus, a lot of medical interventions are damaging that. Autoimmune diseases such as multiple sclerosis, RA, inflammatory bowel, type 1 diabetes, psoriasis, are a heterogeneous set of diseases that share common hallmarks, including multifactorial etiologies involving T-cell mediated autoimmune pathomechanisms, chronic clinical course that often requires lifelong disease management. Now, it's interesting because health freedom or freedom of speech in today's climate, we cannot talk about T-cell mediated autoimmune pathomechanisms. We can't, because that's a medical procedure that we could call, I don't know, what do you think, Voldemort? Okay, yeah. The procedure that must not be mentioned? Okay, good. Yeah, we could go with that. Because in the other part, there's a certain medical procedure that children get 72 of them before their time they're 18, and a lot of them are forced now in order for you to keep a job. But those initiate a T-cell mediated response, typically a Th2 inflammatory response. So when we look at this, we're looking at Western societies are having a greater burden of chronic illness. And Dr. James Chestnut came up with this brilliant idea, okay, that it's rocks in a backpack. Okay, the more rocks you have, the harder it is to keep afloat. So if you look at say, a child, okay, they're going to get multiple inflammatory things. If the mom had a C-section, she might have trouble with oxytocin let down. She might not have milk production, so the kid's going to be raised with a soy-based formula, of course genetically modified. High fructose corn syrup is usually the main ingredient. If they have antibiotics because they were C-section, that's 4 times the amount of pressure on a child's neck. So, of course, the antibiotics, which are used to treat the ear infections, but most ear infections aren't infections, they're ear effusions. Then Tylenol, which depletes glutathione, which can protect the brain. Asthma medications, which are steroids, which again weaken the body's immune system, and cold medications. And this is standard for a little kid. Okay, now, kid gets older, they go to the school, and they're going to eat this food that kids eat. Genetically modified high fructose corn syrup diet, which causes non-alcoholic fatty liver disease. Ritalin, because they are going to be a little hyperactive, and it's kind of cool. If you give a class 2 narcotic to a child, it has the opposite effect or a calming effect in a kid. No, don't think about what class 2 narcotics do long term. Antidepressants. Now, even though antidepressants are called selective serotonin reuptake inhibitors, nobody really knows how they work. But if you understand that anxiety, stress, and depression are the frontal lobe, and the frontal lobe can be programmed by the cerebellum, there's actually natural solutions for that. Of course, nonsteroidal anti-inflammatories, because our backpack's getting heavier, and more antibiotics. Then they get a little older, antacids, sleep medications. Our bones are going to get thin, high blood pressure, cholesterol, diabetes. This is society. And so if you drug somebody's response to environmental stressors, the outcome is not good. So when we say that rheumatoid arthritis is not the body attacking itself, that it's a tissue production problem, any rheumatologist in here would go, God, that's so far afield, I can't even think about it. Okay? But everybody else with common sense is going to go, God, that makes so much sense. It's a tissue production problem. You build the body healthy. So let's look at this. Autoimmune disease rates increasing. With a rapid increase in autoimmune disease, it clearly suggests that environmental factors are due to play significant increases in these diseases. Genes do not change in such a short period of time. Now I'm going to get yelled at because I raise my voice, and there's a bunch of people that turn their volume up and they say, don't ever scream, okay? But this, I think, deserves a little volume increase, okay? Genes don't, so how many times have you heard, oh, do your family members have it? It must be genetic. No, I'll tell you right now, your great-great-grandparents and your great-great-great-great-grandparents, the 10,000 generations that preceded you did not have that, or they could not catch the antelope, okay? You wouldn't have made it, okay? So this is foolishness. The best way to combat the rise in autoimmune disease is to do research and understand the genetic environmental risk factors for them. So the highest risk of developing disease after certain environmental exposures might be to minimize those exposures and prevent the development of autoimmune disease. So environmental exposures. Well, let's look at this. So you've got joints, okay? And I'm just going to demonstrate the hip because it's really, really kind of cool, okay? And I've had two hips for over 62 years now, so I think qualifies me as an expert. Okay, some of you have had hips longer. Don't give me that look. But you've got a capsule around it, okay? Now, you can't see the capsule here. The capsule literally goes from this rim here to back behind this round part, okay? And it's flexible. You can see when it stretches, down here it's going to pull it. When you compress it, it balls up because that capsular ligament is huge. And think of this. It's strong. It's flexible. It's amazing. Okay, because it's designed to hold fluid. Now, if you've had trauma or if your hip isn't there, then the capsular ligament may have to be used beyond its design. Okay, does that make sense? And morons will say it's calcific deposits in there. However, the body doesn't put calcium just randomly somewhere, okay? But if you design, or if you use a ligament, and think of this, okay, you've got two bones coming together surrounded by a joint capsule. If that joint starts to desiccate or dry up, it becomes unstable. And the capsule that's just supposed to hold the fluid in that joint has to become structural. Okay, now is the body smart or is the body smart? I'm only giving you one choice, okay? So if the body is straining that joint, then the body's going to change the matrix to that to be a more bone-like or stiffer. And so moron doctors will call it calcium deposits. That's just stupid. Okay, smart doctors will say it's an ossification, or it's literally turning those ligaments into bone. Because you cannot see ligaments on an x-ray, but you can see bone on an x-ray. Now here's a patient, and it's interesting too, because rarely do I see perfect hip joints. Okay, where you're seeing a hip coming into a joint like this. Okay, I'd say probably it's 80–90% of the time, the acetabulum, or the part of the pelvis that accepts that femur head, it's not fully formed. Or the head of the femur is a little off. I mean, maybe super athletes like Carl Lewis or, you know, these high-level guys are going to have perfectly formed hips. But I don't see a lot. Now, this is actually the hips of a super, super famous healthy gal, you know, teaching classes, working out every day. But we're looking at 20, 30 years of degeneration. That's most of her life. But it's not really degeneration. It's really the body adapting. But what's wild is, see the little red arrows over there? Okay, let's blow it up. Okay, so this is what you're looking at. On the left, you're seeing a normal hip, kind of like this, okay, where the hip goes in the socket. Now, that hip on the left, you can literally see it looks like it's going into the socket. In fact, you know what? I'm going to go grab a spine just for a second. Okay, so I'm going to walk off camera just for a second. That's called poor planning on my part, because I should have had this with me, okay? So what you're looking at, and this is hugely important, this is for every doctor out there, looking at that film on the left, it looks like this femur is going into a socket like that, right? Yes or yes? That's not what you're seeing. I'm going to show you how to look through the joint, okay? And this is huge because it goes into this socket here. Now, you're actually looking through the front portion of the socket, you're looking through the back portion of the socket, and since the top of the socket is so thick, that's all you're seeing. You're just seeing that coming into the front. So now, if you're looking at that picture on the bottom on the left, you can see a variation in gray. You can see it where it looks more dense the closer to the pelvis. That's the back half of the socket. And if you're really good, of course, I marked this, you can kind of see on the front part of the socket a really light thing coming over the front of that femur head. Okay, that's the front portion of the socket. So I just showed you to have that x-ray vision that everybody in here wanted when they were teenagers. Every guy anyway. Okay, so this is the socket. Now, if we look at the other one, we're going to see that the socket was never really fully formed. It was a partial socket. And so that partial socket, and I've seen partial sockets in so many people. We've got a couple of gals, one gal from Montana, one gal from Texas, that I'm talking, they had 4 kids, riding rodeo, barrel races. I mean, you know, it's fully functional, it's just not completely in the socket. But what we're seeing on the bottom where I have the red arrow is this capsular ligament that's bound up, it's squished up. And since it's been used beyond what it's supposed to be used, it's starting to ossify. Okay, does that make sense? So the problem is that's starting to limit the motion. And then every joint around this has to communicate to the brain. So there's a neurologic component. And has anyone in here ever seen pulled hamstrings? Was it slow or does it look like they were shot in the leg? Shot in the leg. That's because you have mechanoreceptors around every joint. And the joints in the knee and in the hip are going to send a signal to the brain to say, hey, look, the leg is bent, relax the hamstrings, fire off the quadricep, and then the leg straightens. Leg straightens, then sends a signal up to the brain, the leg's straight, okay, relax the quadricep, fire off the hamstring. And it happens so fast, you can actually propel yourself 20 miles an hour, some guys 30. Okay. Now, if you get a signal that says, look, fire off both the hamstrings and the quadriceps, bam, that pulls the hamstrings are going to lose that tug of war, and the guy goes down like a ton of bricks. So the pulled hamstrings is a joint mechanoreceptor issue, just like this here. Now, one of the things you're seeing before and after, because we're actually breaking up that. Now, we're creating inflammation at the joint to break up the adhesions that have been forming over years. And it may be hard to see from where you are, but it's actually kind of cool. Now, we've got to do we have to get the blood healthy, knowing that it's got to get into that joint? Super important. So anything that thickens blood, and what thickens blood? Battle. Physical, chemical, emotional stress. Polyunsaturated oils can damage the arterial wall. So when you're creating inflammation, you've got to get good nutrients to that joint so the body can regenerate. Now, just looking at rheumatoid arthritis, because remember, they say it's the body attacking itself, but let's look at this. 1.3 million in the US. I mean, that's a lot. According to the CDC, which are, does anybody in here have respect for the CDC after the last 2 years? Nobody? 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 I want to get one of those things that sound like a cricket. Okay, the CDC says RA occurs when your immune system attacks the synovium, the lining of the membranes that surround your joints. The resulting inflammation thickens the synovium, which can eventually destroy the cartilage, bone, and joint. Okay, that's crazy, because inflammation is the healing process, and you got to have actual damage there. Let's see the Mayo Clinic. Doctors don't know what starts this process, although a genetic component appears lightly. While your genes don't cause rheumatoid arthritis, they can make you more susceptible to environmental factors, such as infection, viruses, and bacteria may trigger the disease. Except that's not true. It's supposed to be symmetrical. Are you going to have symmetrical infections? That would be rare. And attacking the synovial membrane, well, wouldn't drying out or desiccation of the joint be also a leading factor in that? Since the joints are hydraulic, they're not getting the fluid. That does make sense. So the real causes of this, the first one is Voldemort. And again, talk about that. Antibiotics, medications, environmental toxins, processed foods, sedentary lifestyle, and literally physical, chemical, emotional stress. It seems too simple that you got to heal the body, it's a tissue production issue. Now, people are told, and I've got, hundreds and hundreds of patients, over 50, with a shoulder pain going up to their medical doctor, and they say, Doc, my shoulder's really bugging you. Well, you're over 50, it's arthritis. It runs in your family. No x-ray diagnostics or anything. Okay, you get that label, and then you're going to get some drugs, because they are pharmaceutically trained. They're not trained to restore the nervous system. They're not trained to restore the biomechanics. Those are physical therapists. You'll be told incredibly stupid things like hereditary, it runs in your family, we just don't know, trauma, old age. Old age, okay? I was looking at a patient who was 69 yesterday, and honest to God, she looked 90, could barely walk in here. I'm 62. I've been run over by a car. I've been dropped off a building. I'm telling you, I've had multiple bones broken, and they heal. Really, really. And you could still be strong after that. I don't recommend being hit by a car, though. It hurts. Okay, so repetitive motion, that's insane. You're able to do the same task a lot. People are able to do it. But again, they'll lie. If you do repetitive motion with compromised nerve supply, then you can have damage. Okay, here's an example. That's a normal curve in the neck on one side, that's a reverse curve on the other. Now, let's say you got a 2.5-year-old kid, C-section birth, that's a reverse curve in the neck. Are they going to have good function or poor function? Yeah. So what do they have? Skin issue, behavioral bowel breathing and skin issues. This is what this kid's going to end up with. It doesn't sound like two of those are like tissue production issues. So when we look at this, osteoarthritis is a mechanical adaptation. It's a mechanical adaptation from trauma. That means if that disc gets less, and now discs have a horrible blood supply. If you're looking at the discs at the base here, and you're talking about a 200-pound man, and you cut this torso off, you're looking at over 100 pounds on something the size of a 50-cent piece. So that means discs would be crushed. So discs get their nutrients, and disc is a ligamentous tissue, through movement, through imbibition. So bam, we got a trauma. Instantly the muscles tighten up. Limiting motion. That limiting motion causes the joint to get compressed. The joint gets compressed, does that mean it's unstable? Yes, because the disc used to be here. So the body is going to, in its infinite wisdom, increase the surface area of the bone to stabilize it. So again, doctors that are trained in completely stupid stuff, they're going to call those bone spurs. Okay, they are not bone spurs. This is an adaptation to inappropriate biomechanics, to instability. So it's the body doing everything it can to stabilize it. It's brilliant. Now, when we see this long term, if you see a reversal of the curve in the neck, now that's a negative 19-degree curve. Okay, forward head carriage 12 millimeter, that's over half. Now, grade 3 arthritis means this trauma was more than 25 years ago, 25 to 35 years ago, could have been. But this is not something recent. Now, 5.5 weeks later, okay, we're looking at an 8-degree curve, so 19-degree reverse down to 8 degrees. We're looking at forward head carriage 12 millimeters down to 8 millimeters. And this is decades old injury. So the body, if you place it under a different force loading, if you cause inflammation, inflammation is a healing process of the body. You cause inflammation, the body can regenerate. Okay, and I guarantee you, after this, someone's going to say, what do I do for inflammation? Guaranteed, okay. So Kirkcaldy and Willis, this is one of the books that we used when we were teaching biomechanics. This is like the biomechanics Bible. They took joints out of old cadavers, joints out of young cadavers, put them under compression and torsion, found out old ones just as strong as the young ones, baby. Okay, isn't that cool? Okay, I know. So this old thing that you got to get brittle when you age. No, what happens when you age, you're in a greater state of stress, you have less stomach acid, so you're producing less amino acids and proteins. So you can counteract that by getting light amount of exercise, healthy nutrients, and get off of any medications that slow or stopping metabolic processes. Okay, arthritis doesn't happen when you're older. It doesn't. It happens from trauma. Now, look at this neck here. We're looking at a reverse curve. The top bone in the neck, okay, it's actually the second bone in the neck. We're looking at a perfectly healthy joint. Okay, does that make sense? So all those joints in that neck are the same age. So if somebody says, well, it's from old age, no, it's from trauma. They're all the same age. Or you can say that one at the top is just younger. Okay? See how foolishness it is? But you know, when you perpetuate stupid, okay, to sell a chemical product that alters your physiology, you can see how it can get confusing. Now, a ligament is the toughest thing you've ever seen. 80 interconnecting rings of ligamentous tissue. You can take a probe that looks like a pencil, pass it into bone pretty easy. You can't beat it into a disc with a hammer. It's amazing. So to have a disc herniate is very unusual. Now, when we look at here, we're looking at normal X-ray, X-ray with a reverse curve, and an MRI. Now, the MRIs are done completely incorrectly. But kinda, you know, you can't really get a clear picture of a disc injury off of an MRI. Well, for two reasons. One, the position. When you're laying down, you got gravity pushing down and the table pushing back. Okay, that's one. Another, inflammation distorts the image. Now you got a computer that's trying to interpret this magnet spinning around a human being, putting all the hydrogen ions in one direction, so it's supposed to interpret that. But you know, and it wants to get a pretty picture, so it lies. Okay, it tries to get a pretty picture, but so you can't really say that that's an actual bulge in the spinal cord. The only way to really test it is to get a stress weight-bearing X-ray, and they know this now, and now they do have some weight-bearing MRIs, but they still have the problem with the computer interpreting or misinterpreting inflammatory responses. Just look at these. Look at these two people here. You've got a normal on the right. Look at how the bones are more or less the same shape coming down. Look at how on the left, how they start to distort out. Because when that disc space gets compressed, the body has to lengthen the surface area to stabilize. So this is a stabilization aspect. And of course it's called degenerative disc disease. It's also called degenerative joint disease. It's also called osteoarthritis. And when you look up the definition of degenerative disc disease, it says it's the end result of trauma. It's not a disease. And this is why I've told a number of doctors, no wonder people are confused, because it's not an inflammatory joint issue. It's not a disease. It's directly from trauma. And this is what every research out there says. Okay, so this is an adaptation. Now, why would this be important? Well, when you have a reverse curve, this is putting direct pressure on the spine. Now, if I go in there and I stab anyone in here in the neck with a pen for 20 years, are you going to fill that pen, or are you going to just not understand why you're in a stressed state? So when you're looking at a reverse curve that's been there 10, 15, 20 years, you're looking at some kind of trauma that was never addressed. So what does that mean? That means that person is in a chronic sympathetic dominant state. When you see a reverse curve, is that person sleeping good or poorly? Are they going to be overreacting to any kind of stimulus? Absolutely. Because they're supposed to. They're going from one trench to another trench. Anybody in chronic pain is going to have that same. And that's one of the tough parts. That's one of the tough parts because, I mean, you got to literally change your lifestyle. And do you know how hard that is when you're in constant war or battle mode? It's fucking horrible. Okay? And what happens is the subluxation means that you're limiting that communication from the brain to the body. When you see an alteration in structure, your body can't communicate to the brain and the brain can't communicate to the body. And trauma, toxins, thoughts. When we look at this, kinesiopathophysiology means there's a problem with the movement. Neuropathophysiology means that there's an alteration in the autonomic nervous system, either direct compression or something. Then you've got myo, the muscles fire off. Histo, that means the cells in that area, the disc get compressed, the bone starts to inflame or distort. And pathophysiology, we're looking at destruction or degeneration of the body. So all of that stuff can be reversed, but you've got to address the neurologic component first. And I've got this couple, husband and wife, and I want to show you, you can see a reverse curve in her neck, okay? So that means anyone that has a reverse curve has had to have some kind of a whiplash trauma. Now, what we do to see if the joint can work, we put them in extension, okay? Now, this is a beautiful extension. I mean, beautiful. Why do I say that? See how pretty it is? I mean, it's all nice and curved and everything. So this way, if somebody says, can you fix me, doc? Yeah, I got a good objective analysis that all the joints are working right. Okay, now, let's take the hubby. The hubby also has a reverse curve in the neck. However, but look when he's bending backwards. It's not curving pretty like that, is it? Now, there's no limitation of the joints, but there's a limitation of proprioception, of the brain. This is why, if you've had a hip issue, okay, do you have to retrain and change your brain how to walk again? Yes or yes? You also have to retrain your brain how to move. This is why we give exercises to train and to change that proprioceptive aspect. So training the neurological aspect, to retrain your body, that new position and motion, is that important or important? And again, I'm just going to run through a couple of these. 90 days, okay, pre and post. High blood pressure. Did he ever have high blood pressure or did he have stress? The stress. And that's why it's ridiculous to think that you're going to actually give somebody a drug to lower blood pressure and not address the underlying cause. That's ridiculous. I mean, this was old in 1998. The right drug at the right time in the right dosage killed over 100,000 people. No, nobody went to jail. Okay, they're the ones that fund the government, so don't be ridiculous. Who's going to go to jail for that? Okay, later on, a few more years, 128,000. I think they stopped doing the studies because they realized that it would probably become more and more and more. Okay, and you don't want to mess with who's paying for your campaign. Okay, Vioxx killed more people in the Vietnam War, and it was only on the market for 5 years. And I know what you're thinking. Pharmaceutical industry is like gods. Anything that they make must be sanctified. No, they actually made some mistakes. Okay? Well, they also made a shitload of money too, 2.9 billion in just 2003. Okay, so it's really the cost of doing business. Now there is corruption. Since 1992, the FDA, the Food and Drug Administration, or Fraud and Deception Association, okay, they turned the drug companies are paying them. Now, do you know how many drugs the FDA checks every year? How many they test? None. They're not a testing agency. The people that make the drugs do the testing, pay to have the people look at the drugs, and there's nothing to see here. This is why you can get Vioxx approved and passed and certain other things, even with, I know it sounds crazy, but like with emergency use and poor testing, and then have it forced on the public. That's amazing. Okay, but arthritis correction, you got to look at the whole body. You can't look at one joint. If you look at one hip as a problem or one joint has a problem, that doesn't make any sense because this is a tissue production issue. Again, we're looking 58-year-old with a trauma, reverse curve in the neck, a nice correction. I think that was after about 6 weeks. 50-year-old, severe trauma. We're looking at a negative, 11 degrees down to a negative 3 degrees. We're looking at how do you check for, you do stress x-rays. You bend the body one way, bend the body the other way, and see how the body moves. And this identified 4 abnormal discs. So fix the biomechanics, fix the gut, change the physical, chemical, emotional stress. Because if you're going to drug the symptoms without addressing the problem, cardiovascular events. Wait, wasn't that article that I just put up that said modern societies have a reduction in infectious disease, but they have a rise in what? Autoimmune and cardiovascular diseases? Wow. Non-steroidal anti-inflammatories like Advil, Motrin, and Aleve. 40 to 6% increased cardiovascular problems, hearing loss, gastrointestinal bleedings, GI complications. And this is stuff you can legally get over the counter in America. Cardiovascular issues, gastrointestinal issues. Now, what about natural stuff? Vitamin K has been shown to kill the cells that damage the synovial cells. It actually stimulates, it causes the bone to remineralize. Vitamin K. Vitamin K comes from grass-fed or organic animals, eggs, butter, dairy, fermented foods, cheeses. How to optimize your gut flora. You just put healthy stuff in your system. What I tell patients, when they say, well, what diet can I use? Okay, eat exactly what your great-great-grandparents ate. Okay, because they were crazy. They only ate organic, they only ate free range, then they only ate seasonal. That's a joke. Like when you're 200 years ago, that's all they had. Curcumin, okay, turmeric. I mean, think of this. It creates a microenvironment. And this is actually, I'm married to a Pakistani gal, okay, so I know this stuff a lot, okay? Okay, microenvironment creates, which affects the pro-inflammatory cytokines, which are antagonized into facilitating chondrogenesis. In English, it facilitates the building of cartilage, okay? That's huge. And what do non-steroidal anti-inflammatories do? They destroy proteoglycan, the building block of cartilage. So if doctors were really aware and wanted it and had to be involved in the outcome of your patient, okay, wouldn't you want to give somebody that would something that would regenerate cartilage instead of something that, here's an Advil, and it'll make you feel better while your body is destroyed. Okay, anti-inflammatory, which means it helps with the inflammatory process to build tissue. Antimicrobial, it kills infections. Antioxidant, regenerates tissue. And anti-cancer. Now, carotenoids. This is amazing, and this is what you got on the back of your sheet. Okay, now imagine best sources of this, and these are studies. The American, like if you're watching Dr. BVIP, the handouts would be up there. But these things reduce lung cancer, colon cancer by 41%, macular degeneration, help athletic performance, brain health. And where do you get this stuff? Carrots, sweet potatoes, kale, spinach. Literally, you're going to eat the way your great-grandparents ate. So what do you need to have healthy joints? You need to get the nervous system working correctly. You got to have regular exercise, proper nutrition, sufficient rest, and prayer and meditation. Does that make sense? Okay, we're going to get into scary stuff now. Stuff that the government says that you should not see. And I actually took some of these slides out of the presentation that we just saw because it wouldn't be shown on certain venues. So I'll see you next week, YouTube and Facebook people, but Dr. BVIP, hang in there a second because we're going to switch right over. God bless you. Thank you for making it here. Hit the like or subscribe button, although I think they blocked that because we've been at 714,000 subscribers for